Hello everyone. I am Kamal Narayan, CEO of Integrated Health and Wellbeing Council, India's premier institution for health awareness, advocacy, and behavior change. It is my privilege to connect with all of you on this special occasion of National Girl Child Day, a day that is dedicated for protecting, promoting, and empowering our girl child. So, welcome all our esteemed guests on this very special occasion of the launch of our 1000 days long mission. Now, I request Dr. Bobby to take this discussion forward in creating a strong advocacy around why we need to focus on the health of our women and our child for the making of our country a healthier nation. Dr. Bobby, over to you.
Thank you, Kamalji. Or let me start with Hemaji. Right. Where do you think we missed the whole point that it was not merely the delivery of a few services during an antenatal period that made the life of women and children better?
Namaste, everyone. Thank you, Bobby, for that key question to why we're all here resolving yet again for our unfinished agenda of Shapath. I think what we knew was not implemented, and also the perspective of where is the root of the problem was also somewhat missed. We are looking at the whole scenario a little bit differently, even scientifically, because that's the origin of the 1000 days. Because WHO has declared good nutrition in the mother is the start for a good generation next. And we truly believe that women's health is nation's wealth. And though the women will be neglected in every other phase, including from the start point of the girl child, we have a window of opportunity in the pregnant women, because that's the only niche period where she is probably pampered and paid attention to, not because of her, but because of the baby that's going to come. Okay, so whatever the reason be, but the focus lies in there, and we have to encash that opportunity for 270 days, moving on to 365 days of the first year and the 365 days of the second year, in totality, the 1000 days. That's the movement we are focusing on, the ABC of nutrition, right from where it starts. So let's not miss this opportunity again. If we have not done anything yesterday, this is our second best chance here and now. So I think this is the right group with the right mindset, which we have come together, and with the changing scenarios, changing perspectives, let's all start with a positive note and a hope that this one time there is a strong resolve, Shapath, to walk the talk. Namaste.
Hemaji, thank you so much. And thank you for reminding me that the best time to plant a tree was yesterday. The next best time is today. Hemaji, I started with you and had to go all around to get the contextual issues, because if we have to go to a 1000-day perspective and go forward, many of the background, whether it's society-wide, whether it's the gender perspectives, whether it's the barriers, all of them that need to be addressed, yes, we have talked about them. But when we come back to it, the 1000 days really is the pregnancy and going forward. If all these things that we have talked about are somehow coming together, and I'm saying somehow coming together, it's not like a flip on and off switch. There's generations and millennia of thought processes and attitudes and behaviors that need to be changed, but assuming that they are working in a direction. And there are leaders like Sanjeev Navangul and Ravi Bhatnagar and the other men here who are going to basically reduce the barriers. Then what do you see the probabilities of success for a Shapath campaign like this? And what do we want to see happen?
I will wait for a cue from Kamalji when the honorable minister joins.
I will
So
let you
it
know.
typically happens that in every program
Sure.
when I'm speaking, the guest comes. So that's a good omen. So Kamal, please don't hesitate to interrupt if Ashwini Chaubeji joins in. So, it's so delightful that most people on this panel, or most everybody on this panel, agrees that there needs to be a change and they are themselves willing to change. That is the first strong point, because oftentimes when everybody wants to see the change. Change you want? Yes, everybody. Will you change? No, I'm sorted. I'm as how I am, but I want to see the change in others. That's a mindset which we have to move out of, and then we have to take. And as many have expressed, what is it that we can do? What is it that we can contribute? That it should become the key question to ourselves. And in that, again, I come back to Shapath, come back to the 1,000 days. And as Urvashi ji said, as healthcare providers, using the digital technology, we should ask ourselves, are we doing enough for pregnant women in alignment with Anemia Mukta Bharat? Are we doing enough for the Poshan Abhiyan, the nutrition, the ABC, which we have just started a campaign, and Anemia also test, treat, and talk? Are we supporting it to the extent that each one of us could? Because these are points of opportunities where we can implement and make an impact, get the data on the table, and say that this is our start point. This is a targeted community that we have been able to get at and address. And yes, it is not so broad or so big as many others. And if we see that whether mother-in-law or husband or whoever, doesn't really matter. This generation, that kind of support and help may be required. But as we move ahead, the next generation of girls who are educated and earning for themselves and more empowered, definitely these kind of barriers will automatically change, because they will present themselves having understood how in the urban, the preconceptional care, they do come. And Sanjeev ji, I have to tell you that infertility couples, that is a large target for preconception. They're coming there because they cannot conceive. Okay? So that is a large target available. But are we doing enough for the double burden of undernutrition, obesity in those couples? Are we doing enough for their sugar status, etc.? There are several things that we can work towards. So the capacity building, which is the strength of Asian Research and Training Institute, we have to sensitize each and every provider, both in the public and private sector. Make your practice anemia free. Then the whole country becomes anemia free. Make your practice, with the BMI of the appropriate expectation come forth, whichever way you do it. And how they have to do it is something that we need to build the capacity of the front lines, as well as every healthcare provider, which is really, really falling short. Everybody is telling and talking, but it's not getting there, because even scientific community discussions, there are a lot of gaps that we need to bridge. The recommendations by the government for nutritional risk assessment, for example, are excellent, but they have not gotten off the ground and they're not implemented. So I truly believe in innovative way of digital technology where we can reach the unreached, and implementing that, bridge that gap, make it narrow, and show the impact. So slowly, as we move several days in this 1,000 days, I was just discussing with Kamal that our role would be the back-end work of actually documenting the data, making an impact, bringing that to the table, so that each time we get around to discuss the next step, we look back and present something which has turned better, and then move a couple of steps forward. So that is what is, my thought process. And we really, again, emphasize that each one of us are willing to walk the talk, and let's get together and do something that would be meaningful to make this world a better place.
Thank you, Dr. Hema.
चूंकि आज हम महिला और बाल दिवस के स्वास्थ्य की बात कर रहे हैं, एक मिशन उठा रहे हैं, विमेन एंड चाइल्ड, हेल्दी विमेन, हेल्दी चाइल्ड और हेल्दी इंडिया का, तो सबसे अच्छा होगा कि जो आज का हमारा समापन है वो किसी महिला के साथ हो, तो मैं डॉक्टर हेमा दिवाकर, जो कि महिला स्वास्थ्य के लिए बहुत ही पैशनेट तरीके से काम करती हैं, पूरे देश में काम कर रही हैं, बल्कि विदेशों में भी काम करती हैं। तो डॉक्टर हेमा दिवाकर, आपसे अनुरोध करूंगा कि आप एक वोट ऑफ थैंक्स से इस मंत्री जी का जो है आभार व्यक्त करें, और हम उसी के साथ आज के इस प्रोग्राम को समाप्त करेंगे।
नमस्कार, थैंक यू कमल जी। अश्विनी चौबे जी, सम्मान से मैं ये कहना चाहती हूँ कि पिछले प्रोग्राम्स में भी आप हमारे साथ जुड़े हुए थे, और आज भी हमारे साथ आप हैं, और आगे भी हमारे साथ रहेंगे, वो हमें यकीन भी है। और हम इसी कॉन्सेप्ट को कंटिन्यूम ऑफ केयर जो कहते हैं, जो फर्स्ट 1000 डेज में जो शुरू हुई, सभी लोगों का ये कहना था कि 1000 डेज पे बंद नहीं होनी चाहिए, और आपका अगर हमारे साथ जुड़ने से सहकार बना रहेगा, where there is a will there is a way, और आपने आशीर्वाद भी दे दिए हैं कि मंगलमय होगा, हमें कोई अड़चन नहीं होगा, और हनुमान जी के भी आपने याद दिलाया। तो सभी तरह से we feel the courage, we feel the strength, we feel very encouraged and very inspired to believe that this 1000 days is a journey which will be very meaningful beyond the 1000 days. And जैसे कि हम चाहते हैं हर चंद दिनों में हम मिलते रहे, आपसे जुड़ते रहे, और we get motivated to do more and more. बस इसी आभार के साथ आपके शुभकामनाएं हमारे साथ हमेशा जुड़े रहे, क्योंकि हम हमेशा कहते आ रहे हैं कि टुगेदर वी कैन। और ये वैक्सीन के बारे में आपने जितना कुछ बताया, उससे ये भी साबित होता है कि हम कुछ भी कर सकते हैं। जब हमने दृढ़ निर्धार कर लिया है, शपथ ले लिया है, तो हम उस शपथ को निभा के ही छोड़ेंगे। इस भरोसे के साथ आपको कमल जी के तरफ से, IHW काउंसिल के तरफ से, हमारे सभी लीडरशिप और चैंपियंस जो हम कहते हैं, उन सभी के तरफ से बहुत बहुत शुक्रिया अदा करते हुए हम सब आपके आभार है। और
बहुत बहुत बधाई।
इतना हिंदी भी मैं आज बोल पाई, मुझे खुद को पता नहीं कि कैसे मैं बोल पाई। थैंक यू वेरी मच। नमस्ते।
हिंदी हिंदुस्तान का, आपने हिंदी को इतना सरल हिंदी आपने बोला है, मुझे बहुत खुशी है। हिंदी को अपनाइए, देश बचाइए।
तो सभी का धन्यवाद, सारे स्टेक होल्डर्स का, माननीय मंत्री जी का, डॉक्टर मीरा अग्निहोत्री, डॉक्टर अल्पेश गांधी, डॉक्टर संजीव कुमार, उर्वशी प्रसाद जी, रवि भटनागर जी, डॉक्टर लक्ष्मैया, संजीव कुमार जी, थैंक यू सो मच फॉर helping us, for joining the hand with us for this 1000 day long journey to make Bharat healthy, to make every child, every woman of our country healthy. Thank you so much.
नमस्कार।
नमस्कार,
धन्यवाद।